You wake up one day and your hands have turned into tree bark. At first, it looks like dry skin, maybe just irritation. You rub it, wash it, try to ignore it, but it doesn't go away. Instead, it spreads. The texture thickens, hardens, and slowly starts taking over your skin. What you're seeing isn't normal, and it isn't temporary. It's a condition so rare, most people will never hear about it in their lifetime. It's called epidermodysplasia vericiformis. Epidermodysplasia vericiformis, often nicknamed tree man syndrome, is a genetic disorder that changes how your body deals with a very common virus known as human papillomavirus, or HPV. Most people come into contact with HPV at some point. In normal cases, your immune system recognizes it, controls it, and you never even noticed it was there. But with this condition, the immune system doesn't respond the way it should. Instead of stopping the virus, it allows it to grow inside the skin. And that's where things start to change. The virus triggers abnormal skin cell growth. At first, it shows up as flat, slightly discolored patches. They might look like dry skin or mild eczema. But over time, those patches begin to thicken. They harden, they rise off the skin, and eventually they can form rough, bark-like growths that resemble tree branches. The reason it looks like bark comes down to how your skin is built. Your outer layer of skin is made mostly of a protein called keratin. Normally, your body produces and sheds these cells in a controlled cycle. But in this condition, that cycle speeds up and becomes unbalanced. The skin starts stacking layers on top of layers, creating thick, hardened growths. Combined with the viral infection, the result is that distinct tree-like appearance. This condition is extremely rare. Only a few hundred cases have ever been recorded worldwide. And in most people, it starts early, usually in childhood or the teenage years. The cause is genetic. People with epidermodysplasia vericiformis are born with mutations in certain genes that control how the immune system reacts to HPV. These genes are supposed to help your body recognize and fight the virus. When they don't work properly, the virus is able to stay active and spread across the skin. One of the most well-known cases is Dede Koswara. His condition became so severe that thick, branch-like growths covered his hands and feet. Over time, it made it difficult for him to do basic things like hold objects or walk comfortably. Surgeons perform multiple operations to remove the growths, sometimes removing several pounds at a time. But because the root cause wasn't cured, the growths eventually came back. His story showed the world just how serious this condition can become. Living with epidermodysplasia vericiformis isn't just about the physical symptoms. Everyday life can become challenging. Simple tasks like grabbing something, using your phone, or even getting dressed can become difficult depending on where the growths appear. There can also be discomfort, cracking of the skin, and sensitivity. And because the condition is so visible, it often brings unwanted attention. People stare, they ask questions. Sometimes they don't understand, and that can lead to isolation. Another major concern is the risk of skin cancer. Over time, the infected skin cells can become unstable. In many cases, especially with exposure to sunlight, these lesions can turn cancerous. This usually happens in early adulthood for many patients. That's why people with this condition have to be extremely careful with UV exposure and often require regular checkups to monitor any changes in their skin. Diagnosing the condition isn't always immediate. In the early stages, it can look like common skin issues, which means it can be misdiagnosed. Doctors typically confirm it through a combination of skin biopsies and genetic testing. Once diagnosed, treatment becomes focused on managing the symptoms rather than curing the condition. There's currently no permanent cure, Treatment usually involves removing the growths when they become too large or uncomfortable. This can be done through surgery or other medical procedures. Some medications are used to slow down skin cell growth or support the immune system, but results can vary. In many cases, the growths return over time, which means treatment becomes an ongoing process rather than a one-time fix. There is some hope in ongoing research. Scientists are studying how the immune system interacts with HPV in people with this condition and looking into potential gene-based therapies. While nothing is fully solved yet, each case that's studied helps build a better understanding of how it works and how it might be treated in the future. At its core, this condition is a combination of something extremely common and something extremely rare. A virus that most people carry, and a genetic mutation that prevents the body from controlling it. On their own, neither would cause this, but together, they create something that can completely change a person's life. And it all starts with something that seems small, a patch of skin, a slight change, something easy to ignore, until one day, it's not.